Money, Marketing, and Misrepresentation: How Addiction is Encouraged by Society, by Devin McKnight. While many people believe that drug addiction is caused by personal circumstances, numerous cases prove that addiction can be an effect of a more complex situation. The best example of this in the United States is the opioid crisis. In the 1990s, an increase in opioid overdoses was noted. This is because a new opioid called Oxycontin was put onto the market. It was advertised as being non-addictive, so it was prescribed generously by doctors for people in chronic, moderate, or severe pain. Quickly, it became apparent that Oxycontin was much more addictive than originally advertised. Areas with an abundance of blue-collar jobs were negatively affected by the opioid crisis because of the high rate of work-related injuries. Currently, opioids account for a majority of drug-related deaths. For many of the victims, they were initially prescribed Oxycontin for chronic pain and then became resistant to their original dose and reliant on the medication. Due to the improper regulation of the marketing of Oxycontin and claims made by Purdue Pharma about the drugs, many groups of people were negatively affected. Oxycontin is a painkiller and an extended-release form of oxycodone. They are both opioids. Opioids are made from opium or chemicals with the same structure as opium. There are three categories of opioids: natural, semi-synthetic, and synthetic. Oxycontin and oxycodone are semi-synthetic because they are made in laboratories by chemically processing natural opioids. Opioids are a unique class of drugs because they can be used as drug therapy or they can be illegal. Oxycontin is a prescription medication created in 1996 and is considered a Schedule II narcotic. Schedule II drugs, substances, or chemicals are defined as drugs with a high potential for abuse, with use potentially leading to severe psychological or physical dependence. These drugs are also considered dangerous. While this drug is highly addictive, it is extremely effective in reducing pain levels. Purdue Pharma is the pharmaceutical company responsible for the creation of Oxycontin. It was marketed as being non-addictive because the extended release prevented users from getting a euphoric high. The Food and Drug Administration, also known as the FDA, made a special label for Oxycontin that stated that iatrogenic addiction was very rare when it comes to this drug. When the drug was created in 1996, Purdue Pharma made sure that it would be profitable through aggressive marketing. The first thing they did was promote the drug as being able to be used every day and return people who had formerly lived in chronic pain to living normal lives again. They hired young, attractive sales representatives that were responsible for getting doctors to trust these claims and start prescribing Oxycontin. Sales representatives would get trained on how to market the product. Before going to the doctor's office, they would look at that doctor's profile to learn about their personal and professional lives to gain a better understanding of the doctor and eventually that doctor's trust. These sales representatives would show up well-dressed and with gifts. They would fill up the gas of the doctor's cars to talk to them for a few minutes about the topic, bring gifts to the receptionist so they would be let into the doctor's office, and bring the doctor their favorite food. They even had Oxycontin merchandise, which was used to make the pill seem less scary. This merchandise included Oxycontin pillows, mascots, pens, binders, lanyards, etc. They also took doctors and their families on all expense-paid Oxycontin symposiums at luxurious resorts and destinations. Like Alexander Wood promoting his syringes and Dresser with his sleepy frogs, Purdue Pharma's David Haddix touted Oxycontin for all kinds of chronic pain, not just cancer, and claimed it was safe and reliable with addiction rates of less than 1%. Haddix heralded that statistic to the new army of pharmaceutical sales reps Purdue Pharma hired. They fanned out to evangelize to doctors and dentists in all 50 states with this message. Prescribing OxyContin for pain was the moral, responsible, and compassionate thing to do, and not just for dying people with stage 4 cancer, but also for folks with moderate back injuries, wisdom tooth surgeries, bronchitis, and temporomandibular joint disorder, or TMJ. The 1996 introduction of OxyContin coincided with the moment in medical history when doctors, hospitals, and accreditation boards were adopting the notion of pain as the fifth vital sign, developing new standards for pain assessment and treatment that gave pain equal status with blood pressure, heart rate, respiratory rate, and temperature. The sales representatives received bonuses based on how many milligrams the doctors were prescribing. As they became more established, doctors began to trust them and prescribe higher dosages, and their bonuses got exponentially larger. The sales representatives went from receiving $80,000 bonuses to $1 million bonuses. While OxyContin was effective in reducing pain, it was much more addictive than Purdue Pharma had originally disclosed. Its risk of addiction was said to be less than 1%. For many people with chronic pain, OxyContin provided relief from the pain and allowed them to sleep through the night. Soon after getting on the medication, they started to develop a tolerance to it. It was recommended to be taken every 12 hours, but when patients started to develop a tolerance, they would want to take it more often. To combat increasingly frequent use, they would be prescribed a higher dosage of the pill. They never reach a baseline of tolerance, so they continue to try and get that same feeling of pain relief for the rest of their lives. A lot of the time, they become dependent on the drug and then addictive. It controls their life. This is classified as opioid use disorder, also known as OUD. OUD is a complex illness characterized by compulsive use of opioid drugs even when the person wants to stop, or when using the drugs negatively affects the person's physical and emotional well-being. It only takes 2 weeks of consistent opioid use for a person to become dependent. In 2011, OxyContin made up 25.5% of all prescribed narcotics and ranked number 1 in the top 20 drug list based on total claims paid. After people became reliant on the drug, it was not as effective as it had been initially. Doctors were also prescribing OxyContin loosely because of the claim that it is difficult to become addicted to. The new idea that pain is the fifth vital sign made doctors more willing to prescribe OxyContin for pain, even though a person's pain levels were determined by the patient themselves. This made the pill easy to access. Many people began to chew the pills or crush and snort them. The crushing of the pill removed the time-release properties and allowed for users to experience a high. In 2003, only 7 years after OxyContin was put onto the market, it was found that over 1 million Americans had tried OxyContin at least once in their lifetime. More than 645,000 people in the United States have died from overdoses involving opioids since the epidemic began. This crisis claims more than 220 lives per day. The promotion of the risk of OxyContin addiction being less than 1% made the drug extremely hazardous. OxyContin was originally marketed towards vulnerable populations. This drug was said to be used for chronic, moderate, or severe pain. The vulnerable populations were Appalachia, specifically southwestern Virginia and eastern Kentucky, and rural Maine. These jobs were labor-intensive and resulted in chronic pain due to injuries received while working. In Appalachia, coal was the primary industry. Coal miners were exposed to dangerous working conditions that could leave them with chronic pain. This being the primary industry made it difficult for workers to find other jobs if they became injured. In Maine, the primary industry is logging. Another reason that these areas were chosen was because of the lack of political concern towards these areas. One book stated, "They also happened to live in politically unimportant places, hollows in towns and fishing villages, where the treatment options were likely to be hours from home." OxyContin was able to get a foothold in America through these communities before the rest of the country became aware of its dangers. Lee County, located in far southwest Virginia, had been severely affected by the opioid crisis. In 1998, 24% of Lee High School juniors reported trying OxyContin, and so had 9% of the county's 7th graders. As addiction rates began to rise, so did crime and jail occupancy. OxyContin wreaked havoc on vulnerable communities by creating a foothold that allowed quiet expansion to other areas of the United States. OxyContin is a poor person's drug. Unlike cocaine and heroin, which were high-functioning drugs, OxyContin did not provide people with energy. It made the user's minds and bodies so reliant on the drug that they could not work well while on it. Insurance could also cover the OxyContin. It was prescribed to patients from a doctor and paid for by insurance companies, making the cost extremely low for the patient. The cost of living in southwestern Virginia and rural Maine is inexpensive. After OxyContin came out, unemployment rates went up because people could make a lot of money by selling their pills. If a person is prescribed 80 milligrams of OxyContin for 30 days and they are selling their pills for $1 a milligram, they are making $2,400, which is more than enough to live off of for 1 month. For the addicts, many became impoverished to keep up with their addiction. One example of this is a physician colleague treated a septuagenarian farmer who had owned land worth $500,000. Within 6 months, the man had sold everything he had to keep his addiction fed. OxyContin made individuals, families, and finances dependent on the drug. Some argue that because Appalachia and rural Maine had high rates of poverty before OxyContin was created, these populations are more likely to become drug abusers. One experiment determined that children exposed to poverty have a higher chance of having drug abuse problems when they get older. A quarter of those who reported illicit drug use in the past year reported a total family income less than $20,000. This supports the argument that people in poverty are already susceptible to drug use, and OxyContin was not a unique case. This argument could have validity in general, but in this case it is not rational. False marketing was directed towards people in pain who were willing to try any treatment to help reduce the pain. Doctors were willing to prescribe this drug because it was the first opioid with such a small chance of addiction. The harm Purdue Pharma did was not in creating the drug itself, but in lying about the drug's potency and the risk of addiction. While there is a possibility that OxyContin would have become abused by people in these areas, the rate at which people became addicted was too high to blame solely on being raised in poverty. The marketing of OxyContin by Purdue Pharma was extremely misleading and put communities at risk. It is important to understand and address this specific event and how it influenced poverty because critical regulatory bodies, such as the FDA, were responsible for keeping people safe but allowed for misleading marketing of this drug. This marketing created high profit margins for Purdue Pharma and ruined blue-collar communities with high addiction rates.